From Texas, we stand with Southerners for Medicaid expansion because families shouldn't have to choose between paying for their bills and groceries or paying for their health care.
I believe it's a great idea for the southern states that did not implement Medicaid expansion to unite their voice to demand healthcare justice. I want everyone to keep in mind, and I'm specifically talking to about the epidemic of HIV. The southern states actually comprise 50% of all new infections. And although across the nation there have been a decrease in deaths related to HIV, that is not so in the South. The South still account for nearly half of all the people diagnosed with HIV who died in 2016. So we must unite.
I was a person that was recipient of Medicaid, and I was diagnosed with HIV in 1993. When I was diagnosed, they told me I would be dead in 3 months. If it wasn't for Medicaid, I would not be here 26 years living with HIV.
For the HIV positive community, Medicaid is actually critical. It's because of Medicaid that many of us have been able to stay adherent on our medications.
You know, we're all just hoping to live longer lives and more healthy lives, and it is Medicaid and that little bit of safety net that helps us do that.
I was able to get my college degree, but Medicaid helped me get to that point. And it had not been for that service, I wouldn't have never made it.
When you have people with continual illnesses such as hepatitis, HIV, AIDS, they need to have continual care. They need to have doctors they trust. They need to not put off those decisions because they can't afford them today.
We're working so hard in our community to end HIV. It's impossible if we can't get people into care. The safety net of Medicaid is the most important thing in our lifetime.
What Medicaid expansion will do for those living with HIV, it will make sure that everyone has access to treatment as well as pre-exposure prophylaxis to prevent transmission of new HIV infections. So when you have treatment and when you have prevention together, we can help end the epidemic for HIV.